Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Brands podcast. I'm your host, Bash Moreno. Gracias a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you're watching or listening to this podcast. I appreciate all the love and support. Continue to rock on and follow the podcast on all social media platforms. On Instagram, you can follow the podcast at the Social Work Rants Podcast. That's all one word. You can follow the podcast on Twitter at Social Work Rants and hit that like button. Type in the Social Work Rants Podcast on Facebook, aka Meta. Hit the like button. And of course, on YouTube, hit the red subscribe button. Subscribe to the YouTube channel. All podcast episodes are on audio and also on visual as well. Uh, and speaking of the audio, uh, it's on all audio platforms. So definitely rate the podcast, leave comments, leave reviews on the podcast, whatever you like or found interesting or like to know more about it. So again, thank you, everybody, for your love and support with the podcast, rocking. Gracias otra vez a todos por su apoyo. This episode of the podcast is brought to you by Bassity Entertainment, your home for online holistic self care featuring poetry and Zumba with my book, uh, Trying Through Pain How to Maximize Your Full Potential During Hard Times, available at www.bassmoreno.com. That's BASMORENO.com. It's also available on Amazon on paperback. Coming soon, it'll be audio as well. So it's coming. I've been honestly been slacking, so but it's coming. Um, so that being said, before I get started on this week's episode, I did want to also let you know that my next speaking engagement is May the 4th. That is a Wednesday, if I'm not mistaken. Yes, it is a Wednesday, May the 4th. It's part of the Latinx and social work monthly talks that's been happening. There is a monthly talk coming up on the 26th of April. And so basically back to back weeks, there's a talk featuring the authors of Latinx and Social Work Volume 2. For those that don't know, I am one of the authors of the book. That book is also available. Be getting a lot of good feedback regarding the book as well. So you can definitely grab your copy as well. Definitely pour my heart and soul into writing the chapter in that book. So um, May the 4th, I'll put the link in the show notes so that you can come through. Myself, Elizabeth Conte, who's been on the podcast, Erica Sandoval, Dr. Bryant, and Carolyn. We will be rocking and rolling, talking about grief and how we overcoming grief to pretty much keep it moving and thrive despite grief. So, perfect uh, conversation to have in honor of May is Mental Health Awareness Month, so it'll be a perfect topic to kick off the month. The talk was originally scheduled back in March, so due to low turnout, it got pushed back to May. So I got confirmation as of this recording that no, it's happening. So there's still availability to sign up and to get LB in the show notes, both in the audio version and also on the YouTube channel as well. That being said, if you've been following the podcast these last few days as I record this episode on 420, and I've been following the last few days. Basically, I've been talking about the ending of the COVID emergency that President Biden signed officially, ending all emergency benefits for people, COVID benefits. And again, for my out of the country listeners and viewers, uh, back when the pandemic first happened, there was an emergency order in place. So basically, what that meant was people got food, was getting food stamps. They were given many were given more money into their food stamps. People who had Medicaid, they did not have to recertify. So basically, the medical coverage of the Medicaid was continuous throughout the pandemic. And now, as of April, and I found out today that it might have even started earlier in a few states. Why I bring this up? Because people are not talking about it. And people need to be talking about it. People, especially if you work at a community-based organization that does bill for Medicaid services, it's going to affect you. We're anticipating millions and millions of people losing coverage, and it's important to share the information out, um, and talk about this because people need to recertify, and the powers that be, uh, in terms of the government, are not doing not as good of a job to letting people know about it. So, um, I'll give you a perfect example. Here in the state of Delaware, they're going to be contacting people by text and through email. For people who are seniors and might not have capability of, as clients with flip phones, so uh, they're not great with technology, so they also going to be find out through mail. But if you know anything about Medicaid, if they contact you a couple times, they don't hear from you, they cut you off and use the excuse that we try to reach you, and then it's an ongoing battle back and forth trying to get coverage. So what does all of this mean? So President Biden basically discontinued the emergency plan that took place during COVID. So all the COVID benefits will be slowly coming to an end in a state near you. Um, so, like I said, this, and I will focus on Medicaid because I know I worked at an outpatient mental health clinic that relied on Medicaid dollars, and I ended up being laid off. So, if you work at a nonprofit, you will work doing case management, doing any sort of case management or anything with that you build Medicaid for, you um, therapy, and you bill for Medicaid, anything related in the field of social work related to Medicaid dollars. Just be mindful that people's going to have to start recertifying. They're going to be contacted through the phone, text messages, through email, and then they will or should receive a letter letting them know it's time to recertify. So if they get some type of Social Security benefits, or they work, they got to show pay stubs, they got to show the SSI award letter, whatever proof of income they have, they need to provide proof. Any sort of they pay rent, any sort of utilities, provide proof of that. Proof of residence, that whole bit, and they'll make a determination whether uh, you know Medicaid will continue to a person will still have Medicaid, um, and also the food stamps are going to go back to pre-COVID levels. So whatever a person had in food stamps before pandemic started, that they're going to go back to that. And unfortunately, it's not a good time for that because we're in a recession slash inflation time. So no matter what the government says. It doesn't say we've been in a recession for a while. So on top of that, inflation's been happening. So um, is real for folks out there. And so like I mentioned uh, last week's episode, those of you in private practice, get ready to do some case management in your private practice sessions. And so it's just a fact, and we're not even talking about potential housing situation because rents are through the roof, and people can't afford to live where they at, and even if they try to move to another state, like rents, housing is lack of inventory, or they're building new construction and it's taken a while because of COVID. You can't get the parts to fast enough to finish building these new construction for housing. So the supply chain issues are still happening. So everything that's happening within the economy is somehow indirectly is affecting those in social work. So I am not seeing people talking about it. So I'm bringing it to the table and to educate you guys. And for those of you in MSW programs or about to graduate, and coming into the workforce, and thinking you're going to save the world, one client at a time. These are the issues that you're going to be facing going into the field. So be mindful if you're looking for work, and ask like what, like how you guys get funded. I know, I know I've asked that um, because of my past experience of being laid off, or seeing funding being cut. Like I always ask in the job interview or in past job interviews I've had, like what does the funding source look like? Like how I'm gonna get paid? How's the program run? So um so all that kind of goes like hand in hand, is like kind of layers upon layers. Peel an onion, like you see multiple layers, so it kind of all goes in together into a melting pot. Um, so I've been bringing this up. I did a IG live this week, and also did a post I think last week about it. When it was finally nationwide, like the Biden administration was letting people know that this is happening, and went on a live, and people asked like, "What does this mean?" Like, so basically, I'm explaining some of the stuff of what this means in terms of you know Medicaid, food stamps, housing is like kind of indirectly affecting too. So if you, and of course the Republicans have control of the House, unfortunately. So they're always looking at cutting, 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 cutting. So um, we got another maybe year and a half of them controlling the House. So um, and both sides, both Democrats and Republicans, do things not in a good way to really help the American people, and what they do affect us in the field of social work. So, and we out here trying to trying to make whatever they give us and try to make it work, and do the best we can. So, uh, this is a short episode. I didn't wanted to come on real quick and provide this education. Uh, in your individual states, please go to whatever Department of Social Service website, whatever is the main entity that provides Medicaid and food stamp coverage. Look that up. So, like for example, New York is HRA. Here in Delaware is the Division of Health and Social Services. So, whatever your state entity is in terms of Medicaid food stamps, there should be something on the website letting them know that this is happening, and start educating your clients, your patients, people you serve who have Medicaid, or people that you know personally, and like, hey, like, just be mindful, be on the lookout for a text message saying it's time for Medicaid recertification, and it's gonna look weird because you've been automatically recertified for the last like 2.5, almost 3 years, and now we want to go back to pre-COVID. That you got to show proof, like I mentioned, of um, income verification. If you pay rent, mortgage, provide proof that you're paying bills and making sure bills are under your name, or things of that nature. So um, I did wanted to share that with you guys, and that is pretty much it regarding this episode with this topic. Go back to my IG post. I did an IG live about it, so you can get a little bit more info. And again, go look up website, Department of Social Services, whatever main entity in your state that provides Medicaid and food stamps. Look it up. It should be on the website because it is coming from the federal government. So um, it trickles down into the states. So it should be on your state website, or just do a Google search, talking about the um, the ending of COVID, uh, uh, the COVID Act with the Medicaid and food stamps, emergency food stamps, the kind of like state of emergency related to COVID is over, and states like um, states like Delaware are slowly trickling down. It's not happening all at once. So it's going to be trickled down for the rest of this calendar year of people. So you might have a patient who might not get a letter until like December, like you gotta recertify. So, and it's going into the following year, early 2024. So it's going to be a slow rollout, or it's supposed to be a slow rollout um, throughout the rest of the months. So you will be a lot of patients will or clients will be lucky enough and not having to recertify right away. But again, just to be mindful, keep an eye out, keep an ear out. There's always new info that's coming out. That's why I don't understand social workers who be like, I'm not into politics or anything like that, but like the stuff is happening out there, and we gotta keep informed, be informed of what is happening, and like we gotta be informed with evidence-based practices that are happening, or new updates to the code of ethics, and new updates to this and that. We gotta be updated on what's happening in real time, day to day, regarding our patients, because a lot of our patients, our clients are suffering out there, and they looking for us for support. And sometimes we don't have the answers. Sometimes we like with our hands up in the air, like, I wish I could help you, but I can't. Um, or I could refer you to somebody who might be able to help. And it's a sucky feeling that you're get paid to try to help somebody, and you don't have the resources because your state and local officials doing all these cuts, and all these services are being cut, or you live in a rural area that's like you're remote, and a remote area that doesn't have a lot of services to begin with, and you trying to provide services, and it's kind of hard to provide what when nothing is around. So um, just something to think about, keep in mind, be mindful about. Just some education, because y'all gonna learn today one way or another. Y'all gonna you guys who watch and listen to the podcast. Yeah, it's all about providing the education, just to be mindful. All right, so hope I see some of y'all on May the 4th. Latinx and Social Work Author Talk, 6 p.m. Eastern Standard Time. There's only an hours from 6 p.m. to 7 p.m. May 4th. Hope to see you out there. My next speaking engagement, I'm looking forward to it. Is going to be amazing, amazing. And I'm always looking to do more speaking engagements, especially topics of self care. Um, and if you want to get on the podcast, definitely email me, Bassity Entertainment LLC at gmail.com. We could get you on the podcast. We already going um, into the first week of May. So I already got an episode lined up and a scheduled episode to record. Um, so that'll be like week, knock on wood, that'll be week 2. So we'll be middle of May, winding down May, going into already Memorial Day weekend coming up pretty soon. So yeah, summer baby's gonna be feeding for the heat, and it's been unseasonably warm where I'm at in Delaware, and I was hoping for some snow, and that didn't happen this winter or this spring. So um, and I don't like the summer. So shout out to everybody for rocking and listening to the podcast, watching the podcast, subscribing. The subscriber numbers are increasing, and I appreciate all the love, support, and feedback. Again, leave comments in the YouTube. You watch the video, leave a comment on what you liked about the episode. Leave comments on the audio side of the platform of the podcast. And again, if you want to get on the podcast, by all means, definitely let me know. We get you on. And for those of you who bought my poetry book, shout out to you guys. Appreciate it. Again, the book is available on bassmoreno.com and also on Amazon. And the audiobook is in the works. So, but there's another Zumba class coming up for May. So be on the lookout for the date, and continue rocking, continue supporting, stay safe out there. With the heat and the weather, sometimes acting crazy, crazy for lack of a better word, and things are happening in the world. So find some peace, uh, practice your self care, whatever works for you, and just be safe out there. Talk to y'all soon. Peace.